So thank you again for the warm welcome and the opportunity to share space with fellow hygienists. I'm grateful to be part of the conversation surrounding community outreach because it really is impactful. I definitely enjoy doing it, and I definitely believe that it improves our health outcomes long term. So I'll be sharing an overview of Liberty's mission, our outreach efforts across the state, and how we expand access to care, particularly to the underserved communities. I'll walk through some key initiatives, including our week of service, which we're really excited about, highlighting how we promote oral health literacy, prevention, and serve as a community resource. My hope is that this session will offer in some insight as hygienists can help to bridge the gap in care, but also play a meaningful role both inside and beyond the operatory. So let's get started. Why community engagement in oral health matters, right? So we have 43% or only 43% of US adults visit the dentist annually. So I think it's because dental care isn't always accessible, if oftentimes it is inaccessible. And it's a matter, it's more than just skipping appointments, right? It's about affordability, it's about availability, it's about awareness. It's also deciding to put, food on the table or paying out of pocket for dental cleaning. So we always obviously know what the obvious choice there is. We have over 68 million Americans lack dental insurance, and I think that is because insurance, especially dental insurance, is usually an add-on and not necessarily a necessity. There is such a, where there's a medical and dental distinction, and we don't necessarily put them together. As we know as dental professionals, that everything starts in the mouth. So it's really important that, hopefully in the future that we make sure that dental insurance is just as important as our medical. Uh, one in five, of 1 in 5 children in Florida lack dental access to routine dental care. And I think that's realistically speaking, it's where you live and what you earn, unfortunately, determines if you see a dentist, right? Because there are pediatric dental deserts that exist. There's also transportation issues. What if it's a single parent? What's their schedule look like? And this predominantly affects low income and minority families. Um, 56 million Americans live in areas where there's a shortage in dental professionals, right? Providers are not distributed evenly, right? This mostly affects rural areas, low income urban communities and also those with special care needs. So it's kind of two facets where it's like the issue is they're trying to find a provider nearby to them that also accepts their insurance, that's most often Medicaid, and then they have to see if that provider meets their specific needs. So then we also have 2 billion annually is spent on preventable ER visits for dental conditions. And I think, you know, um, dentistry is all about prevention, right? But you can't prevent anything you're not seeing, right? So when preventative care is delayed, small problems become big problems, right? Small problems become emergencies. So people end up in the ER not because they want to, they just feel like that's their only um, sense of getting care, or they don't have an established dental provider. And in the ER, they can't fix the root canal cause, right? They can only manage the pain and not necessarily the problem. And then we consider high risk groups that include adults with IDD, seniors, and rural population. And I think these groups face a compound barrier, whether that be physical, cognitive, financial constraints, location. Hence the reason I think community engagement is rather critical. Engagement and education are key to closing the gap, especially because too many people don't realize that poor oral health is a real health risk. It's not just cosmetic, it's not just aesthetics. So, our focus is advocating for prevention, equity, and access. Our mission is to ensure that individuals, regardless of income, regardless of location, or socio-determinant of health, has the opportunity to, achieve and have access to optimal oral care. Therefore, we have an amazing mobilized team called our Community Smiles, and that's been inception rounding out 7 years or so, where we meet people where they are. We are especially focused again on that underserved and high risk population. Through strong partnerships through our local organizations, we bring education, the screening component, the fluoride applications, the dental resources directly into the communities that need it most. And honestly, I mean, I feel like it's practical, it's patient-centered, and it's how we aim to do our part to reduce disparities. But I also think, patients won't always remember that, that I gave them floss. I think they remember, how they feel seen, heard, empowered to hopefully improve their oral health as well. So, turning our vision into action. Um, so we take an active role, as I said before, in closing those care gaps and meeting people where they are through our screenings, through our caregiver education, through our partnerships rooted in those communities. So whether that's a Head Start program, screening through foster care space, volunteering with Special Olympics, Mission Smiles, Freedom Clinic, and also Florida Baptist. I think that we're really helping the goal of making oral health resource more accessible as often as we can. Something that we have upcoming or in the process is as part of our state mandate, we're working closely with health plans to formulate templates to bringing data sharing and coordination of benefits more effectively. And I think this will help us to kind of close the loop on care, identify unmet needs, and ultimately drive better oral and overall health outcomes. And we're just kind of actively exploring those templates to best guide us through this process. But no matter the setting, I think one of the most powerful tools we have in each space is education, because that is where you really have real and lasting change begins. And I think oral health literacy is often the missing component. Although we do equip caregivers, families, individuals with tools and knowledge tailored to their needs, I definitely think that education becomes the first line of prevention. It's not about, giving out a toothbrush, it's explaining the why, like why the brushing twice a day matters, showing the connection to broader health outcomes and how oral health affects our overall health, and really making that message stick. And it's similar to in private practice where, a patient has a lengthy treatment plan, they have to buy into the why. That's the only way that they're coming back. So making it as relatable as possible is really important. Because again, as we know, when we have people understand the why, they're more likely to follow through. And that's where you turn the education into empowerment, right? So, if you look at oral health associated with several conditions, right? If the patient has diabetes, did you know that, if you have poor oral health, it makes it more difficult to control your diabetes? Well, why? Well, chronic inflammation through the gums raises blood glucose levels, increases insulin resistance, therefore resulting in poor glycemic control, right? If you think about seniors and cardiovascular issues, bacteria from gum disease enters the bloodstream and contributes to arterial plaque buildup. If you think about the IDD population, poor oral health can increase pain, right? Behavioral issues, nutritional deficiencies. So the biggest correlation here is a healthy mouth contributes to a healthy body. They are bidirectional, just as diet and exercise. So I think that's a big component to understand. Um, and as part of our commitment to advancing and access to care and addressing those oral health disparities, we're launching our first week of service in the month of October, Dental Hygiene Month, which is the statewide initiative to deliver free preventative dental services, education to those who need it most. This initiative initially focused on underserved areas with low utilization rates or dental care were underutilized throughout school-based programs, partnering with mobile units, and events hosted by our providers or community partners. And what makes this effort so special is that it goes beyond this week of service. It's part of our larger Pathways to Prosperity models or framework designed to connect people not only with just care, but long-term resources and community support through the platforms like findhealth.org. So while Week of Service opens up our doors, it continues through our collaborations, and we definitely want to keep those doors open. So that's where we need everyone on this call to, actively engage with dental hygienists, students, and other community organizations, whether that's hosting an event, volunteering, or helping us reach communities. We'd love to have you in really creating a meaningful impact. So what can you all do? As I said before, is you want to make sure that as a hygienist, you have a powerful position to connect with people, to build trust, to create real change. Every day we educate, we advocate, and we engage, and that alone makes an impact, right? But there's also a world beyond the operatory where our presence is needed, whether it's volunteering through, your county Department of Health, supporting caregivers through education, or simply pointing patients towards really great resources like Florida Baptist that they didn't even know existed. Really are moments that matter and create ripples. So I encourage you all to look for those opportunities, not just because you have to, but because hopefully you want to. So let's really lead in ways that you know how, through outreach, through equity, through education. Um, because let's be honest, it's not that we're, addressing plaque, right? We're addressing fears, those access issues and barriers, one conversation at a time. So thank you, everyone. And if you ever want to reach out, of course, if you all, any of you want to reach out, you can definitely email me. I'm definitely, I think, a wealth of knowledge in regards to finding volunteer opportunities. So please feel free to reach out.
This, and coordinating with your team, even getting me together to get me on time with my slides. She has to be working some miracles in the background. So thank you, Stefanie, for tipping this off. So my name is Dr. Tamara-Kay Tibby, and I am the dental director for Liberty. I've been with Liberty for about 3 years now, and in my role for about 1.5 years, thoroughly enjoying it. And that's my contact information if you need to reach me. I think Sue and Kathy and Alan will probably have that as well to roll it up, Misty and Stefanie and my information. Sometimes, I'm just gonna skip through the slide. I went to do UF, Harvard, and USF from training. I spent the majority of my career in public health, as Sue mentioned, crisscrossing the state and working as dental director in different health access settings. That's my passion, and working for Liberty, I can continue that on a larger level, helping to get access to care for patients. So it really is a great place to work, and I feel like we're doing a great job at trying to increase access to care for patients. So this is an outline of what I'm going to cover tonight: an overview of Liberty, coordination of care, partnerships, clinical oversight, and as Stefanie mentioned, turning the state purple in October, and then dental hygiene scholarship, which we'll also touch on today in this presentation. So when I say I work for Liberty, people get excited and they're like, Liberty Bibbity, like they think that we're the, Emu and his cohort. So this is not the right Liberty. We are Liberty Dental Plan. So we may have to kind of work on marketing to compete with the other Liberty, but happy to say that we have about 1.8 million lives in Florida that we serve, and Medicaid's our largest market, then Medicare, Healthy Kids, CMS, and commercial plans. So again, very happy to be here to talk with you all. And I just want to get like some emojis, interactions. Does anyone on the call, does your office take Liberty? I'm just curious. Anyone give me a reaction or put it in the chat? Yes, no, let us know. Love to know if you're already partnered with us. If not, we pretty much cover a lot of different plans, commercial line, Medicaid, Medicare. So, birth until. So we'd love to partner with you in your offices. You can be our advocate to get us in the door to gain more access for our patients. I'm going to cover some of our care coordination as well, talking about like what members see when they become part of our membership. We assess members for their needs. So any members that have special healthcare needs, say that they're pregnant or they have any sort of like health issues or challenges, we do offer case management. And currently, one thing that we're doing that's very innovative, and Stefanie wanted me to mention this as well, is that we're sharing data with health plans. So our first partner now is Sunshine Health, which does up some of our CMS care. And this really helps us kind of wrap around care for members, get better information about them, their diagnoses, so we can put them into case management, meet them at their needs. We also feel like our biggest strength at Liberty is the people that work there. We have powerhouses. So we have a wonderful case management team that's been in place for some number of years now, a community smiles program that Stefanie touched on today. We also have dentists, including me, ding, that do teledentistry. So we can zoom in and see a patient virtually to kind of get them out of pain palliatively with medications, antibiotics, pain medications. So that's one resource that we offered for our members that we think really is a good resource for them and a good tool to Stefanie's point, to hopefully keep them out of the ER and to get them routed to a place where they can get actual care and get it resolved. So anyone that we see over teledentistry, they normally qualify for case management. So we kind of loop them in and get them scheduled somewhere with a provider. And then the last thing I was going to share about in this presentation is also the providers and CBOs. So we have the lovely opportunity today to bring on one of our community partners, and she'll speak after me, but Missy is amazing with Florida Baptist Bus. I've known of their organization for a number of years, volunteered with them once or twice, and I just love what they do. I love their model. So what we've been doing lately is leveraging these partnerships and our provider networks to really build a base and network of care for patients. So I really love what I do. I love that we get to coordinate care. We feel like we fully wrap around with having our own army of dental hygienists that work and see members and screen them. And then we have this wonderful CBO that we can merge with and have volunteer opportunities. So we hope to kind of loop you all in to be part of this army that's helping to serve a need. So I love to borrow. So these slides are borrowed from Janet Musto. She is our extraordinary case management. And so Liberty is not just in Florida. Even though we have almost 2 million lives here, we have about 7 to 8 million lives nationwide. And we're in different states, including New York, California, Texas, Nevada, and a few others. So case management definitely is a model that we have in all those states. And it's a collaborative service that merges medical and dental needs of our members. So for example, we're able to get medical records for the members to just get all their diagnoses. We merge that with the dental records. We put them under case management, come up with a treatment plan, find them the right provider, whether that's within our Liberty network, or if we have to go outside the network, we'll do that as well. So we really love that we do this. It's kind of proactive in that we offer services to members, and sometimes they decline, believe it or not. So it is offered to high-risk members, people that have complex and physical health issues and barriers to care. Again, a lot of people who I see on teledentistry end up getting case management, and I love that. So our risk program begins at the time of enrollment. And again, now that we have this data sharing with Sunshine and hope to do it with all of our health plans, we can basically implement interventions, early interventions for members, so if they have complex behavioral and medical issues, those are often associated with dental-related morbidities. And then we know that the IDD population is really right now usually saying that they have a challenge in facing care. So case management helps them to get plugged in and to get the care that they need. And it's totally a wraparound with medical and dental partnering to get them what they need. So those are some of the things that we offer through case management, and these are the populations that we serve. So I can't see you guys. I'm talking a mile a minute. I know that. But these are our special populations. I'm just curious if I can get some feedback from you all. How many of you all see IDD members in your offices? I don't see any hearts or anything in the chat. Can you see anything, Sue?
Not.
Oh, I got one heart. Okay. Thank you, Stefanie. And then how many of
get
you,
a heart.
yeah, I got a heart. And then how many of you see kiddos? So those 20 and under, that's what they define as children. Anyone see younger, like teens and high schoolers? No, okay. How about 65 and older? Do I have one? Any?
You have one.
Oh, great. Perfect.
Yes,
Here.
Miss Morgan Real.
Hi, Miss Morgan Real. Thank you for what you do. And hopefully you do take liberty where you are. And then how about pregnant members? How many people see pregnant patients? I can see the chat.
You see, no pregnant patients.
Okay, no pregnant patients. Okay. So we consider these special populations, like every member is special. We do kind of tease these numbers out because they tend to have higher risks and barriers to care, and we are focused on improving their access to care. So that's one thing we wanted to highlight here, that we are definitely motivated to increase utilization for this target populations for Liberty, among others. Okay, so I will move forward then. All right. So some of our best practices is that Liberty does provide an OHRA, which is a screening for members, usually within the first 30 to 90 days of their enrollment. We also have a CRA, and I'll talk about that a little bit more when I discuss the BRUSH program. We consider social determinants of health. We know that people don't exist in vacuums. You're an individual within a family, that's within a community, that's within a political structure or governmental structure or a larger base. So we know that there's definitely onions to peel back when it comes to patients. And so we consider all of those factors when we're helping them access care. We have a dental nursing care plan. So we have nurses, my mom's a nurse, that case manage. I think it's wonderful because they have the experience and background and all the medical, jargons and conditions. And they also been very well educated on dental as well. But it's a multidisciplinary team. I'm part of the team as well, and we will get medical records, dental records. We assist with transportation and so forth. So if you've not heard about our case management team, now you do know a little bit more about them, and you can thank Janet again for these slides. And then a member can be assigned to a care team. The case manager is the nurse. The care coordinator management is dental. We have. So I did mention that one of the greatest resources at Liberty is our team. And so our clinical team does provide synchronous teledentistry. So we do see members in, live via a platform, two-way interaction, where we can actually screen them, assess their needs, and then make a diagnosis and prescribe medications. And then those members usually get routed to case management for continuing care. We also have asynchronous teledentistry where members can upload, we call it store and forward, images of their mouth for a clinician to review at a later date. Usually these are non-urgent cases, so just usually primarily kids, young adults that we're screening to get that first step into dental care, many of them, and then they get routed to a provider office for ongoing care to be established. So because of time, I'm going to kind of fly through these, but we do have a few programs I'm very proud of. One is our BRUSH program. It's a nationwide value-based program. It looks at categorizing members by risk, and it rewards dental offices that are able to lower dental risk, say from a high to a low risk or moderate to low, or to maintain members who are low risk at low risk. So this is the future. Value-based is definitely the future of care. I know the medical side does it quite a bit. Liberty is one of those pioneering dental plans that's had this in place for a number of years in many different markets. And so we're very happy to have this. It's called BRUSH program. Another thing that we have in Florida, which we want to highlight as well, is our DPIP program. And this rewards providers who are able to meet their HEDIS measure. So getting members into care within the first 90 days of enrollment. Access and availability standards are met with those offices. Sealant measures considered, fluoride is considered, and being good partners as well. So those are some of the ways that we try to reward offices and also kind of highlight offices that do well and try to create quality improvement as part of an ongoing provision of care in dentistry. We did it so well when I was in the public health space, the health department, FQHCs did a really good job at looking at quality routinely. We're just trying to push private offices to kind of have a quality standard when it comes to members and target goals. So I did mention resources. I'm just going to pull up my notes to just make sure I didn't skip any additional resources that I wanted to touch on besides our wonderful team members, case management, outreach, again, Stefanie, clinicians doing teledentistry, and then our leadership. So leadership is the driving force behind the DPIP and BRUSH programs, making sure that we get quality measures into dental offices, and just want to improve our members' care and experience as well. So partnerships, this is wonderful. Like, we are proud to have one of our partners here on the call. I did mention before I got cut off. Missy's going to share about Florida Baptist Bus, and we're just proud of all that they're doing and happy to share in that experience and to promote them to our members. So even though we do insure members, we do have a heart for the uninsured family members that may live with them. So we are always looking for ways to route uninsured family members to care. And so that's one thing that the Baptist Bus does well. It does it throughout Florida. So we're happy to partner with them. We also have good partners with Mission Smiles. They're a Tampa-based program, and Freedom Clinic in Ocala, to name a few. We've done a few interactions with them and Zoom calls with them. And in October, I think Stefanie mentioned it, we're going to be kicking off and trying to turn the state purple. So, people say it's a red state. Some may say it should be a blue state. Whatever it is, red and blue, purple, it's all come together. Let's paint the state purple. It's oral hygiene, dental hygiene color as well, dentistry color as well, Liberty's color as well. So we want to paint the whole state purple. We want to raise awareness and increase access to health services for members. Even uninsured family members is part of that week of service. And I want to mention that one thing we're going to launch is our scholarship fund. So we are going to be giving away 2 dental hygiene scholarships, something that we did, I want to say, back in 2021, before we're restarting that initiative to award 2 dental hygiene members of people who are practicing dental hygiene currently and have been practicing at least 2 years in a low access setting. So they're seeing, Medicaid underserved patients. As long as they've been doing that for 2 years, they would be eligible to receive this scholarship. So we'll be kicking that off in October. That's our launch for this scholarship. And we're really excited. We focus on hygiene. One thing that I learned is that there's 18,000 hygienists in Florida and 17,000 dentists. So you've got us outmatched. I think you all do a great job advocating for oral health. You're not uncomfortable telling people to floss, brush, and so forth, and having those engaging conversations. And most hygienists are the ones that I think in a practice that the patient feels comfortable with. You're like the first person that they interact with. So we want to reward hygienists for all that they do, all that you do for members, and to just put a face on that, and to also promote careers in public health, because that is a way to kind of, give and serve, and it can be a lifelong career. So that's basically all I had. I'm so sorry for the technical glitch. I'm sorry, you guys, and I'm glad you guys didn't leave the Zoom. I come back to no one. I was kind of worried about that. But thank you so much for standing in there.
And next we have Missy White. So Missy, go ahead and I'll let you share your screen.
All right. Hello, everyone. And I'm honored to be here today and to share some kind of interesting information with you regarding a ministry that's out there that's with the Florida Baptist Convention. And I serve as a volunteer with the Florida Baptist Convention, as well as many, many other volunteers. We'll talk a little bit more about that. And our mobile dental ministry was started back in 1973. This is a picture of our Bluebird bus, as we call it. And this bus has been on the road and traveling the state of Florida for many, many years. And I'm going to share with you a little later about some exciting news regarding this bus, because we are literally holding it together with duct tape. So we're excited to announce some things that are happening with us and with our convention and the sponsorships that we're having from there. And I love it, as Stefanie mentioned earlier, and Dr. Tibby, that we do have partnerships with other organizations, and Liberty is one of those. We also partner with people like University of Florida. We also have a couple of other colleges that we have partnered with, and mostly we partner with local Southern Baptist churches, health access setting type clinics, and we also partner with associational churches, which is like a collaboration of churches. And so we travel around the state of Florida and do this all year round, and we'll be sharing with you some information and how you can find information to share with your patients as we go through the slide set. And as she mentioned, I'm a dental hygienist. I actually retired from dental hygiene chair side in 2020-ish. I've been doing volunteer work in the meantime, keeping my license up and keeping my skills practiced. So it's really great for me to be able to do that. So many of you know that you may encounter patients who are in pain just through the phone calls to your office. And oftentimes, they're wanting to know if you can offer any type of free care or any reduced care settings. And oftentimes, I don't know about you in your county or your community, but in my community, we have places for children to go, but we often don't have places for adults to go for care. And if they don't qualify for Medicaid, as Stefanie mentioned in her presentation, the ER stays full. We have, I believe that they said about 15% of the patients that come through our emergency room, and I live in Putnam County in particular, are patients who have dental emergencies. So it is a growing problem. And, unfortunately, we're in a time when finances are tight, transportation is tight, it's hard to find providers. So what do we do about that, right? How can we as a community help individuals with their dental needs? So that's the big question. So the Florida Baptist Convention Community Ministries, we're gonna call it short for it's Mobile Dental Ministry Unit, but we're gonna call it MDMU, and I might refer to it as MDU because that's really easy to spit out. So the Florida Baptist Convention is meeting a need to serve those uninsured poverty level populations in our community. And we're doing it across the state of Florida in rural areas and in urban areas where there might not be any accessibility to care. So give you a little history back. I mentioned earlier, we started in 1973. We serve anywhere on an average of 35 to 40 different locations every single year. So the bus is on the road constantly. We have started scheduling week breaks in between because of maintenance, because we just have to take care of it a little bit more now that it's getting so old. So we do travel around. And again, we do treat people who have no insurance and they are at the 200% poverty level in order to qualify. And the qualifications for our program is actually determined by the state of Florida. Because we offer sovereign immunity to our volunteers, and the state specifies certain conditions in order to qualify patients to be treated. We are a 501c, so we are a nonprofit, and we do qualify as a healthcare access setting. So we do have special privileges that are afforded to our dental hygienist in order to serve us, and we don't need a dentist alongside of us. So it's kind of like being an independent hygienist when you volunteer for us. So key leadership that's within our organization, Mark Johnston is our community ministries catalyst. He is the only paid employee, and he also works in a couple of other positions at the state of Florida Baptist Convention. And we appreciate him. He is so avid about providing dental care to patients throughout Florida. He's a great leader. I just admire him. He travels almost to every single site during the year. So he's on the road a lot. So we appreciate him. And I came alongside the Florida Baptist Convention in 2021. He approached me and asked me to start a pilot program because preventive services were such a need, and it was often not provided because our mobile dental bus was mainly utilizing restorative services or surgical services, and the preventive was just completely left out. So I started out in my own church, and I started the first program. We bought all of the mobile equipment. We set up inside a classroom. And so from that time, from 2021 to now, we went from my church all the way up. Now we have 14 churches throughout the state of Florida that is using the preventive services, and we are growing every year. We have more and more calling us saying, we want preventive services. How do I add them? So my job is to train the local churches to host the mobile hygiene preventive unit. And I train all of the hygienists to use the equipment. So we have about an hour-long training for each of those volunteers. And so I think so far this year, I think I've trained about 55 hygienists, maybe 60 or so, in order to use the equipment and, about the program. So super excited about that growth, because obviously in 21 we had no one, so but myself. So it was really wonderful. So let me move on. So the mission of the Florida Baptist Mobile Dental Ministry Unit is to provide ministry tool for the local churches and the associations, and we want to build a bridge between the community and then also give them the free provision of dental care. The ultimate goal, though, for us as a Christian organization, we want to meet the needs of the underserved. We want to share Jesus through personal evangelism. We provide spiritual care also to the believers and unbelievers alike. So we are able to offer prayer with those and spiritual counseling many times. And even in drug abuse, things like that, we're able to get them into programs. So we're kind of a gateway to lead them to other services that they may need, everything from housing to homelessness, just things of that nature. So we're able to guide them and help them through the local church. We also encourage and inspire an establishment of free dental clinics throughout the state of Florida. We do have 3 locations right now that are permanent sites that have their own room or dental unit set up in their own church. And this all stemmed from, starting out with using our bus ministry. So a lot of people say, well, how are you funded? How do you get, the equipment? How do you maintain the equipment? So the Florida Baptist churches that are part of our convention, they give through missions and particularly through the cooperative program. And the mobile dentistry unit was purchased and built through those donations, and also through the McGuire State Missions offering. And they also provide repairs and purchase of new equipment through those tithes and offerings that are taken up at the local church level. So our staffing, as I mentioned earlier, there's only one paid employee. We have other employees that work full-time around the clock all year long, and they do it for free. And I do also my job with the Florida Baptist Convention for free. I was talking to the leadership earlier, and I said, I've gotten to that point in my life where it's the give back day, right? All the things I've learned, all the experience I have, and all of the times that the community supported me, I feel like now it's my time to give back. And I'll not only give back to the local community, but to give back to hygienists and dentists alike. So I enjoy this. This is my passion now. And even though I don't do chair side anymore, it's my time to serve and give back to those who gave to me. So just to give you a little idea of what we have an MDMU transportation coordinator. This is someone who is a couple actually that run the bus. They drive the bus to all of the locations. They set it up, do all the electrical hookups. They maintain the unit, keep it running and get it on the road, and coordinate with local churches for delivery of the unit. Then we have a coordinator. The coordinator stays on the bus with the dentist, hygienist, and other staff members, and they provide support by getting instrumentation for them. They make sure that the equipment is running properly. They sterilize their instruments, clean the operatories, and they support the dental team in general with any other needs, whether it be food or getting water for them, just various things. But they just serve the dental team. And they provide, them with all of the care and love throughout that process. So we also partner with local churches and associations, and they work together to sponsor free services in their communities. So each individual host church will be the ones responsible for recruiting hygienists and dentists, and they also determine their scheduling and they determine their pre-screening process. So they're there and they're working hard. So lay people within each church volunteer along with the dentists and hygienists. So it's community-based and community service. Also, the ministry cooperates with the Florida Department of Health to provide sovereign immunity for the dental providers. And also we have medical providers. So we have nurses and LPNs, RNs that also work alongside us. And so they receive the sovereign immunity from the state of Florida. And then the state of Florida also dictates our scope of practice and our OSHA standards. So we comply with all of that as a 501c. And I'm going to take you through the scheduling. So normally a local church will call the Florida Baptist Convention and they will ask us for a particular date and time to schedule the bus to come to their site. Once that happens, they begin training. We have some other trainers that help them with the bus side of things, and I help with the preventive hygiene side of things. And they begin early, like 8-9 months out, recruiting dental volunteers. They also recruit local church members, local community members, and they provide screening for the patients, and then the personal evangelism and spiritual care. But in a typical day for a screening, I wanted to walk you through a little bit about how the patient goes through the screening process. So at first, they will have a person who greets them, and they will check in, and they will have a chart made, just like as in a regular dental office. Once they sign in, then they will go through a financial screening in a private area. The financial screener provides patients with their notice of privacy practices, and then they also have a training for those screening volunteers, and they have to be qualified through the Florida Department of Health. And our eligibility and our patient referral forms all come from the state of Florida. So the financial screener makes sure that they do qualify financially, and they are receiving those, privacy practices, like as in your office, just like that. The third step is to take a medical screening. So that's where a medical history is filled out, and any patients who might have a condition that would prevent them from having work done, such as, for instance, patients who are on, say, Coumadin or blood thinners, or maybe they have kidney dialysis, or they have a heart problem, anything that might require pre-med or might require a physician signature or authorization. That's where the medical screening comes in, and we take care of that before the patient just shows up for an appointment, and then we find out, oh, they needed to be off of their blood thinner 3 days ago, right? Because the bus is only in one location for approximately a week, and they're going to get one appointment. So once that one appointment is, they show up, if they can't be seen, that's really detrimental to them. So we try to make this medical screening part of the process to ensure that they are eligible to be seen when they come and they sit in the dental chair. Then we have a dental screening, and we normally have assistants, hygienist, or dentist who come to the screening event, and they will screen the patient and just kind of look for their chief complaints, or if they're looking for preventive, then they just write that down. And then that way they step over to the last part, is once we know what they need to have done, then we can schedule their appointment accordingly. And basically they will walk out with an appointment card with a date and time on it. We do that intentionally because if you're aware, sometimes when you go to free clinics, it might be a walk-in, first come, first serve. And we don't want that. We want full dignity with patients. We want them to have an appointment and feel like that they're being seen in a regular practice, because it's super important for them to feel, that they have an appointment. They're not just going to waste a whole day and lose a whole day's of income sometimes by not having an appointment. So we really strive to give them that appointment date and time. So what does a typical appointment week look like? So we'll talk a little bit about that. So the MDU in action is when the volunteer dentist, the dentist, dental assistants, and the hygienist, they actually come on board the bus and they treat the patients. If you look at this slide, you'll see in the background, this is both of our operatories, and we have a full x-ray unit. We have our lights are just like a regular dental practice operatory. So this is just some photos of some dentists and dental assistants who are on the bus working at the time. So the patient comes through, they see the dentist or hygienist, and then once they leave, we also have nurses that are volunteers who help us with the post-operative checkout. And they will sometimes retake a blood pressure just to ensure that the patient's doing well. They will also make sure the patient's feeling okay and that they're able to drive or walk out of the building and be able to get themselves home. They provide things like the gauze pads, post-op instructions, and they also provide a dental kit. And the dental kit sometimes includes spiritual materials or maybe different types of community services. In my particular church, when we have our mission, I actually invite community partners, especially our Department of Health, to come out and give education on like tobacco cessation. We also have something called Baby Brain Builders. They come out and talk to parents about reading to their children. We also provide diabetes and high blood pressure care and information. So we make it a whole thing, and we have tables set up, and while the patients are waiting in the waiting room, they can get educational materials delivered to them from different community organizations. So just to give you a little update and report about what we do and what we've done in 2024. We did 29 dental missions in 2024. We treated 1,787 patients. Out of that, the majority of that was extractions. As you can see, the number is 1,522 extractions versus 770 fillings. So that tells you that there is a need for education. There is a need for preventive services so that we are not having to extract so many teeth, on patients and waiting till they have to have that done. We did 431 cleanings this past year, and the value of our services that we delivered was $1.2 million. And we're already on track in 2025 to exceed those goals. So we're super excited of where we're at the current time. We're not even 6 months in, and we're already past the halfway mark. So we had 155 dentists, 200 dental assistants, 73 hygienists, and 861 general volunteers from local churches. We had 30 professions of faith and about 1,200 what we call spiritual encounters, where people either asked for prayer or asked for some type of spiritual need or physical need that was there and was available to them. So again, just to recap, we have approximately 40 weeks of dental care across the state, serving low income and non-insured community members. Our schedule is posted on our website. If you've got your phone and you want to snap a picture of this, you can, but it's floridabaptist.org/MDU. And if you go onto, as a hygienist, if you go onto that site and you click on that link, you'll see that there is a schedule for the MDU mobile unit. And if you open that schedule, you can print that schedule and you can give it to patients that are in need in your community that might not be able to afford dental care. So if you can't see them in your practice, if you have some of these, you can give them out. I'm also happy to email mail anyone these postcards. I have, this is the back side of the postcard. I have a front side. But I can actually send some of those to your practice if you're out practicing, or if you have local places that you visit and you want to, drop some off, just email me and let me know. I'm happy to get some of those to you. So here's my exciting news, everyone. So we talked about Bluebird 1973, and it's being held together by duct tape. And we are proud to announce that later this year in 2025, we have a brand new bus. Yay! We've had over $1 million donated to us throughout this past year. And we are slated to roll that out. And when we roll it out, I'll be sure to get in touch with all of you to let you know about that. And we're also, we're keeping our fingers crossed. We've actually applied for a grant from a mobile missions clinic, and I've interviewed, and we're hoping that maybe I'll have an opportunity to have a mobile dental hygiene unit that be donated to us at the end of this year. So we're working on that. I've written a grant. It's not a grant. It's an application for a scholarship for a mobile unit. So we're hoping that the hygiene unit will also be established on a, with a mobile unit as well, rather than having to set up in a classroom. Sometimes setting up in the classroom has been a barrier. Some churches don't have a separate room. They just have like a sanctuary, and they don't really have a closed off space to host us. So we have to sometimes, work that out. And we've used people's travel trailers before. We've done all kinds of things to support that church if they really have a desire. Here's a picture of our new bus. That's what it's going to be like inside. We're going to have basically 2 operatories. We're going to have the great thing about this one is we're going to actually install a handicap lift, which is something we didn't have in our old bus. So we're excited to be able to offer that to our handicapped patients. And this is just a picture of one of our classrooms that we set up, and we can set up in a lot smaller space. This was actually a nice open space.